Hello, everyone. My name is Dr. Richard Horowitz. I am the co-host of the Doctor's Talk Healing from Lyme Summit. It is my great pleasure today. We're going to be having a conversation with Dr. Eric Gordon in California. We're going to be discussing pain presentations and atypical ways that Eric goes after these chronically ill patients, about how he gets patients better when other people fail. Dr. Gordon is a family medicine physician and researcher who founded Gordon Medical, which is in Santa Rosa, California. And he treats complex chronic illnesses, including chronic Lyme disease, chronic fatigue syndrome, ME, fibromyalgia, autism, multiple chemical sensitivity, and other illnesses. So, Eric, it's great to have you here today. Let's talk a little bit about why you got into Lyme. I know, you're in California. People say there's not that much there. Of course, there is. But how did you end up getting into Lyme?
Well, first of all, yeah, we're in San Rafael now. We moved south a little
Oh,
bit.
okay.
Not that matters. It's pretty close. It's interesting because it weaves into the chronic pain issues. Is that in the late mid 90s, I worked with Norm Shealy for a year, and Neil Nathan and Norm Shealy, and that was a chronic pain clinic. Okay. And so I kind of got the idea that I did pain. And then when I moved to California, I started seeing people with odd pain presentations. And then in 2001 or 2000, Wayne Anderson joined my practice. And Wayne had been treating Lyme since the late 80s. He and Joe, and probably you guys were on the phone all the time, like figuring out what to do with these folks. Um, and what I realized quickly is that the patients that didn't make any sense to me from a pain perspective, from the way that doctors are taught to look at pain, insofar as it's supposed to hurt in the same place all the time, and and it's not supposed to wax and wane tremendously from day to day. These are things that unless you have MS, that was the only disease that we were taught that would change in time and space. Everything else was this fixed problem. You had arthritis, it was in your shoulder, and that's not what I saw. And I discovered that Wayne's patients, the ones who were treating for chronic tick-borne diseases, because as we all know, it's rare to find Lyme in somebody who's chronic, just Lyme. So I started to pay attention and I started to treat the Lyme because, as you mentioned, people say there's not a lot of Lyme in California, which unfortunately is not true. But when I practice in upstate New York, a little sort of just in the area of Saratoga, Springs, sort of north of Albany. And in the 80s and early 90s, I was told by the infectious disease doctors that there was no Lyme north of the Catskills. if you if you can imagine such an absurdity. But I still remember I had just started leaving the hospital practice, and I had some patients who came to me, and I didn't know anything about Lyme, and people didn't even talk about Lyme much in the regular medical community in the 80s and 90s. Okay. And I had people come to me who tell me, I think I have Lyme disease. And to this day, I feel guilty because I said, no, 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 they told me it can't be up here. That's just a level of stupidity that I'm embarrassed about, that
Oh,
anytime.
don't worry. When we all started, Eric, from the very beginning,
Yeah.
a lot of us had to learn right in baby steps. So
Yeah.
we all made mistakes early on, and we learned from our experience, of course.
Yeah, no, no, but it's a great lesson. Is modern medicine, all medicine forever is full of these pronouncements that we are taught as though they are fact, like they have been, as we say, proven by the double-blind placebo-controlled study. But most of medicine is strongly held opinion by thought leaders, and therein often lies why patients are not believed to this day. And that's a big problem with people with chronic pain and Lyme disease, is because if you do go to your doctor and you tell them that your shoulder hurts on Monday, and but sometimes by the end of the week it's your knee is really bugging you, or your hip, and you have a lot of these burny kind of pains in your body that move around, or even worse, you get this deep pressure pain in your calves. Um, you're often met with the what I call the medical eye roll, which is, sure, nah, they don't want to be insulting, but it doesn't make sense. That's not what the average doctor sees. So to make this long story short, that's why I got into Lyme and began to understand it, and the tick-borne diseases in general, was because people have a lot of pain that doesn't make sense from the traditional perspective,
Right. And you
and
you were doing pain medicine before, like this was a specialty of something that you were interested in doing prior
well,
to it?
again, I was not a pain specialist. It's just that I listened to people, and one of the things that if you wander off um the road of what I call regular medical practice, if you no longer see people just for high blood pressure and diabetes, you wind up seeing a lot of people with pain, because that's what's not understood, because pain happens from so many different reasons. And most doctors focus on, is it arthritis? Did you break it? Or is there an infection I've heard about that's causing it? You
Right.
know?
Well, you bring up an important point. When you were talking about migratory pain, those of us in the Lyme world know, but migratory pain is the hallmark of Lyme disease, right? Whether it's migratory muscle pain, migratory joint pain, or as you were talking about migratory neuropathy, tingling, burning, stabbing, numbness. That's actually the only disease in medicine that, Lyme is the only one that causes it. Although now that I'm finding so much Bartonella in people, I kind of wonder whether Bartonella is playing a role in some of that migratory pain. It has to be discovered. But you're right. I mean, it moves around the body. It's very specific. And you want to talk a little bit, and what gets confusing, I think, for people, it affects inflammation in every organ. So you can get eye pain with uveitis, and you can get pericarditis, right, and chest pain, or costochondritis, bladder pain, interstitial cystitis. It fools people, and they go to subspecialists looking for answers, and they just don't know because they don't know where to look.
Yeah, yeah. Well, the multiplicity of the pain presentations is well, what yeah, often makes us think of tick-borne disease, and I agree. And I always felt so good when you came out with your list, and that was on the top, because that was always on the top of my list. The migratory pains, especially in the early 2000s, our testing has gotten a lot better. But in the early days, the testing was really, yeah, well, it just wasn't that good, because so many people have problems forming antibodies, and that was the only thing we could measure. We couldn't always be sure. And, these, and so this looks like a lot of different things. And so you were right. When people came in after a while and they had pain that moved around, I felt, and I said, and they didn't have MS or a few of the rare things, that they they probably had Lyme disease, so that, or I said, to me, and what I've also learned is, to me, they have a chronic infection, okay, and it's usually not viral. Okay, well, and one of the things that we saw is that when you treat the bacterial, most of the pain, a lot of the pains go away, because we did a study with Dr. Navio looking at trying to do a metabolomics, or a way of defining people with chronic fatigue, and our population was pretty coherent. It was consistent for the findings, because we made sure that our patients with Lyme disease didn't get mixed in. And we did that because we made sure, if we knew they had Lyme, we didn't include them. But if they had just chronic fatigue and we had treated them for their Lyme, we made sure it was gone, because the presentations are different. Though I like to remind people who are treating Lyme that they can have coexistent chronic fatigue, and don't keep giving them antibiotics to get rid of the chronic fatigue. But that's
Right.
that's
And in
another
this day and
story.
age, it's actually not unusual that a lot of our patients come in with COVID exposure, and a lot of these patients may in fact have long COVID. They may have viral persistence, viral reactivation on top of, right, what they were coming in with. So the clinical picture starts to get a little bit confusing, and you really have to know how to do a differential diagnosis.
Right, right. You have to be careful not to keep treating what you think is there. um, when
Right.
it's not quite adding up. So, but getting back to pain, I'm gonna is that I am not a pain specialist, and I never was. My I just happened to wind up in that niche for about 6, 7 years because I wound up working with Dr. Norm Shealy, who's just a brilliant. Was a neurosurgeon and really understood the um, psychological, I hate to use the word psychological underpinnings because everybody thinks that means that if it's a psychological underpinning, that all I need is an antidepressant or a good therapist, and all my problems are going to go away, all my pain problems. No, but the brain is part of the nervous. I mean, the nervous system controls the immune system, and if your brain is always in this fight or flight or fear mode, it's hard to get your immune system to relax enough to do its job effectively over the long run. Okay. Being in fear will give you a lot of transient strength in seconds, you know, but if you stay in fear, that dissipates very quickly, and then you don't have the real strength to persevere. You have to be able to turn down the fear signal. And the problem with so many people with chronic illness is that they're sometimes it's the bugs themselves that produce these chemicals that kind of get our nervous system so wired up. I mean, I really believe that because I've seen, especially with Babesia and Bartonella, I've seen where severe depression, this black depression, will just lift when we treat the bug.
Mhm.
But again, and people say, well, what? Well, depression, fear. Well, depression is what happens in some people when the body can't ever find a place to rest. It just depends how we're wired. Some of us tend more to depression, some tend more to severe anxiety or OCD. It just depends. But when you're chronically ill, you have chronic inflammation. And psychiatry is beginning to finally wake up that, mood disorders are not merely imbalances in neurotransmitters. I mean, that is just like one little aspect of it. But a big part of it is persistent inflammation in the nervous system.
Right.
Um, and that's where the need to understand pain and depression is one story. We have to get rid of this idea that it's some moral failing. I mean, that's the other part that I find so distressing, is that so many patients um, will come in and be so defensive if we talk about the need to find a way to quiet their nervous system, because they feel like, oh, you're telling me I'm just anxious.
No, I mean,
No.
you bring up a great point, which is, and Bob Bransfield, of course, have been talking about this for a long time about microbes and mental illness, but Lyme causes depression, anxiety, OCD. I mean, every psychiatric disorder you can come up with, as does Bartonella, which makes it much, much worse. And Babesia, of course, also increases it. So, no, it's not a failing, but you were getting at this before with Norm Shealy. I affectionately talk to my patients and refer to them as, most of them, as the walking wounded, because many of us, including myself, in childhood, we may have had traumas. It affects us later on, and your nervous system basically gets affected. So I was curious when you were talking about the mind-body effects, which of course is, well established at this point. Do you have specific techniques you teach to your patients? I've learned meditation from my Tibetan teachers. I teach it to patients, but I also recommend things like EMDR and cognitive behavioral and the Gupta technique or Annie Hopper dynamic neural retraining. What do you like to get that autonomic nervous system, central nervous system back in balance?
Well, that is a work in progress. Yes, because what I find is you got to find the right note for the right person. And I just met someone actually who I feel so bad because I can't remember their name, just Monday Eve, just 3 days ago, who has worked out a system of being able to help people find the methodology that's going to work for them to relax their nervous systems. Because, as you probably have seen, if you have somebody who is often, has a very overactive mind and is really, really anxious, meditation can be a hard way in. I mean, for some of them, it's going to be the perfect answer, and for some of them, it's just going to they're going to get more agitated. So it's a question of finding the right tool for the right person. And I start with everybody is just getting out in nature. I think if you can just open the window, I mean, open the blinds, if you can't get outside, but see the trees if you can. I mean, it's hard for people who are in cities and stuck in an apartment, then it gets harder. But any way that you can get and touch the earth and be in tune with nature, even for a few minutes, is going to begin to quiet the nervous system. So, I mean, that being said, and if you have the abilities, again, it's finding out what turns that person on, what can fit with them, whether it's qigong, I mean, sitting qigong, tai chi, stretching in bed. If you're kind of the vigorous sort, you can do, I mean, any kind of, if you can do exercise of any kind, it's changing your state of being. That is the crucial thing, is that when we are ill and we are stuck in depression, anxiety, changing your state physically, if you have the ability, is just amazing. And we have used, I mean, again, Annie Hopper for the people who are more, I don't want to say rule, but people who can follow a regime very well, and that makes them happy. If I tell you to do 7 things every day and you're really happy doing that, then I find the Annie Hopper program really kind of often will meet your needs. But if you're more a little here, a little there, then I think, either the Gupta, I've been using Reorigin of late, this young fellow, Ben Aarons, who actually had Lyme disease, and he, and the thing I have to remind people is that many times you're going to meet folks who have found a way through this mess, through this problem of chronic Lyme and chronic tick-borne diseases. But you have to be kind to yourself because we're all different. Like this fellow, Ben Aarons, he was, bedbound, IV antibiotics, the whole thing. And then one day he started working on himself and over a few years actually cured himself. But this man was a surf instructor. I mean, he paddled, I think, 26 miles, in one time. So those of us, if you've ever been on a surfboard, if you can, paddle, a half a mile, you're really good, and strong and determined, so we're different. I mean, I don't have that kind of drive. Okay. I wouldn't, we all need to hear different messages, and don't beat yourself up, because respect that for you meditation is wonderful, and maybe for you it's not. And walking or physical exercise might be great for one person, and it just might not do the thing that makes somebody else feel really comfortable in their bodies. So we just have to find it. So it's personal, but it's crucial, because if you don't let the body know that it's safe to heal, you're not going to heal. And so, but the basics: sunlight, good. I mean, the things that are hardest for really sick people to get: sunlight, good rest, and good nutrition, and learn how to relax are
No,
the
and safety,
keystone.
as you were talking about it earlier, when I used to speak to Neil Nathan about this, and you were talking earlier about Bob Navio, we
Yeah.
know that if you're not in a safe environment, you're not going to heal because of the cell danger response, right? The mitochondria get kind of stuck, right, in M0 and not M2. They get stuck there. So no matter what you do to people, if they're not in a safe environment, the healing won't happen. And of course, you're right. I mean, with the wildfires in California and the rains and the mudslides, and the climate is definitely causing a lot of climate anxiety, where people are having a difficult time coping. So Eric, if people want to contact you after we're done, what is the best email for them to get in touch with you?
It's just, I believe it's info@gordonmedical.com, or just the best thing to do is just on the gordonmedical.com website. There's a button they can press, and and there's lots of information about what we do and how we do it. So that easy to find. Yes. But you brought up the cell danger response, which is really my favorite topic. I have been lecturing on that for the last 7 years, and I must say, I think I'm beginning to understand it. Um, it's the first time I gave a talk on the cell danger response. It was at ILADS, actually, at the Lyme organization. And I know I confused myself, and I think I confused everyone there, because at that point, I was still overwhelmed by the biochemistry of it. Dr. Navio has one of those amazing minds that he has in his head, biochemistry from almost A to Z. And the rest of us, especially people who are physicians, we have pieces of it, but we forget it because it's not our everyday world. But I think it's so critical because the whole idea of the cell danger response I think, gives people an understanding of why, when we talk about fear and anxiety and OCD, that sometimes can get in the way of their healing. It's not that you have to be this perfectly calm person to heal. Please don't take that message away from what I'm saying. It just helps. Okay. Very, very, very anxious people still get better. Okay. It just means they have to work a little bit harder often, because your immune system just works better when it's not feeling like it's fighting for its life. Okay. Now it still works, but it works better,
Right.
especially over the long haul, especially when you've been in this for a few years. Um, it's really good if you can find places of peace, because that signals your body that life is safe. And safety is so important because basically how we pay attention to anything is this extracellular ATP, this magic, ATP is the energy molecule of the body, the energy currency, if you will, of the body. It's how we sort of save energy and use it someplace else, store it and use it. And but it's also a signaling molecule. Now, normally there's very, very low levels of it outside the cell. And when that amount goes up a little bit, it tells your immune system and the nearby cells to pay attention. Something's happening. And that's how we remember things. We have so much input throughout the day. We can't, if we remember everything, life doesn't go well. Or feel everything. You don't feel your buttocks until I mention them, and then you realize, oh, I'm sitting on something. And that's all that awareness is modulated by changing levels of ATP on the cell surface. I mean, then that gets that whole nervous system and all your neurotransmitters and all that other stuff to happen. But that's kind of the first message. And
So Eric, quick question on that, because it's a great topic. And when I've listened to Bob Navio talk and learn about it, the thing that I found a bit frustrating was that the only drug that they found that was like across the board effective for raising extracellular ATP was Suramin, right, for sleeping sickness,
right.
trypanosomiasis, which you can't, of course, get in the US. And there were studies like on autistic kids that a large percentage of these kids took it, extracellular ATP went up, and their brain function woke up. The closest I've seen, and I don't know if you have any tricks here, the closest I've seen to that may be sulforaphane glucosinolate, which is the broccoli seed extract. Hopkins did studies years ago on autism and found that if they gave 300 milligrams, the kids' brains also a certain percentage woke up. Do you, and I don't know if you have any other tricks, but that's the only thing I've ever come across in the literature to raise it. Do you know of any other ways of like raising this? I mean, of course, apart from getting the nervous system in balance.
Right. Well, lowering it, I mean, it is, yeah. Unfortunately, nothing as elegant as sermon. And I know Dr. Dr. Navio is like focused on like finding other purinergic drugs to like quiet this down. But I think it's so important because as when you understand the system, when you understand the body, so you realize when you're giving when people come in and you're giving them CoQ10 and other things, the whole mitochondrial support cocktail, and nothing's moving. Okay, well then you kind of know that they are stuck in this inflammatory part of the CDR where you're or even I should add, sometimes you'll give them these mitochondrial things and they'll feel worse. Then you know that they're stuck in the CDR, in the inflammatory part of it. And so I just, when I see people, if they're super inflamed and super sick, I kind of know that these mitochondrial cocktails aren't usually going to help that much at that point. We have to, so I use it, it's not so much as a way of finding a therapy, but it's a way of understanding where the person is in the system and helping me have a map to understand chronic illness. Unfortunately, it doesn't give me a straightforward to do. And people always ask, is this the CDR? And I have to tell them everything is the CDR. If you're ill, you're in the cell danger response. And the thing is, you have some cells that are stuck in inflammation in what Bob calls the CDR1, which is that acute inflammatory phase, where you're killing cells or you're killing things, but you don't have, but that can be happening maybe in your intestines, and maybe your liver is stuck in CDR2, where your cells are just producing proteins that are giving low-level inflammatory signals to the body that don't go away. And that's, so it's a complexity that I realize we can't go into right now, but just to say is that when you understand the body through the lens of the CDR, I think you can help tailor programs for people who aren't making sense. If people come in, and I always say, if we can go through the front door with people, which is to treat them with, with either herbs or antibiotics to treat Lyme disease, and they respond fairly appropriately, they have a 2 or 3 day herx, and then they feel a little better, and I can keep going. Then I don't have to worry about where they are in the CDR. Okay, but when I need to think about this is when people come in, and unfortunately, well, anyway, my practice over the last 20 years, that's what's happened, is that we usually only see the people who have failed what I call the straightforward approaches, whether they be the naturopathic approaches, the oral antibiotics, IV antibiotics, ozone, whatever you want to, IV silver, whatever you want to do, we have tried. Okay. In my younger days, I was an early adapter. So we worked, and I had with Wayne working with me, and we had and we had, Dr. Nathan was with us for a bunch of years, and, we tried everything. And so we know what I always believe, that everything works sometimes. And you have to find what works for that individual. So that's where having this CDR tool helps, is because just like I'm interested in this other fellow who has a tool to figure out what type of relaxation therapies or return to your own inner being therapies are right for the individual. Well, it's the CDR gives me a little bit of that lens to say that, oh, okay, this person needs something that's more on the energetic level, that's very soothing, and we got to do a bunch of cleanup before we can ever get to the antibiotic level or even the herbal level.
Right. So, Eric, question. So, a lot of these people are coming in with chronic low-grade inflammation. They can't tolerate treatments. When I look for inflammation, and inflammation obviously is causing pain, fatigue, brain fog, right? All the symptoms we're seeing, mood disorders, sleep disorders. I think of it in terms of the 3 Bs: Borrelia, Babesia, Bartonella. Microbiome may be off, too much Prevostella clostridium, not enough Akkermansia. They've got mast cell disorder, food sensitivities. They're not sleeping. They have mold. They have heavy metals. They have nutritional deficiencies, right? All these things cause inflammation. But if people come to you and they've tried all these things and they can't tolerate the treatments, how do you work up these patients? Like, how do you approach them to figure out, like, how to get them through to the other side?
Well, a lot of it is just understanding that each one of those things that you mentioned can be playing a role. Okay. And we have the beauty of hindsight. I can go over them. I can go over with the patient, what did they try for each one of those things, and what testing they did to look at whether that was there or not. Because often people will come in and they say, well, I've done, mycotox. I've treated my mold. But because there's different schools of thought. One of the problems that we have is that some great doctors, I think of Richie Shoemaker as a great example. They come up with with big insights, and they teach us a lot. But then they see the lens, they see the world through that lens so much, and then when they start teaching it, it comes out as almost like it comes out with rules, okay? And it's what worked for the patients that they saw, but it doesn't mean it works for everybody. So, when I look at people who say, well, I've had mold exposure and I took cholestyramine and I went through the 12-step Sears program. But the 12-step Sears program, people have a hard time understanding that sometimes you actually have to kill the mold, that there is such a thing as colonization, in the nose, in the gut, and you got to kill it one way or the other, um, you know, um, it's the same thing with mast cells. A lot of people treat mast cells are huge because mast cells are your most primitive, I mean, not primitive in a way, but the original immune cell, like that. So they interact with everybody and they're everywhere in your body pretty much. So mast cells are always involved if you're inflamed. If you have pain, they're mast cell involvement. Um, but if your mast cells are triggered because of your mold exposure, treating mast cells from today to tomorrow isn't going to help a whole lot because you didn't deal with the mold. So it's this thing of layering, of knowing you have to know a lot about all the layers so you know where to do it. I mean, this goes, yeah, back to that. There's a concept in osteopathy. I was interested in osteopathy a lot in the 90s, and I still am. I still think structure is huge for people, and we ignore it too much. But anyway, you have to treat people. If somebody comes in with sciatica, you can do the right treatments, but if you don't do them in the correct order for that body, it doesn't work very well. It doesn't hold. And that's the same thing with with tick-borne diseases or any chronic inflammatory disease. Is usually you have to treat things in the right order for that person. And we have our lists. I mean, like in the tick-borne disease world. Remember when we finally learned about Babesia and Bartonella? It was the rules. I think in the early mid 2000s or something. You got to treat Babesia first, and then you got to treat Bartonella, then you treat the Lyme.
By the way, I never did it, and for me, I approach it from the point of view that you have multiple ninjas attacking your fort, and you can't just go after one ninja or two ninjas. You got to deal with the whole tribe if they're going after you. So when I was discussing what I call the 6 rivers of inflammation earlier about, mast cell microbiome, sleep disorders, heavy metals, mold, nutritional, the 3 Bs, et cetera, what I discover is that you're right. I mean, some people, for example, if you try giving them antibiotics and they say, gee, my gut is giving out, I'm either getting candida immediately or I'm getting loose stools, you got to go after the gut and support the gut or the detox pathways first and clean it up, right, in that order. Because if you don't, you can't proceed with the other things. So, I mean, that's taking a good clinical history, right, to figure out what order to do it in.
Right. Well, but it's a good clinical history and knowing the possibilities, and that is the thing. But no, but that's what makes you such a good physician, is that right away that you kind of got in the beginning, that even though people were coming down with these, like, they sound like rules. You have to treat the Babesia first. I mean, that was a big thing. And and patients fall into those traps because, unfortunately, you're looking for guidance as a patient, and when you find somebody who can give you something that sounds like, 1, 2, 3, 4, 5, this is the steps, you do these, you are going to be well. That's very appealing, and that's how our medical system is set up, because that does kind of work for acute illnesses. Okay, things that happen to you today. Like you break a leg, unfortunately, something, you get an acute pneumonia. But once you have a chronic illness is about your body interacting with the environment. Okay. I mean, an acute illness is also, but we all kind of act the same, pretty much in an acute illness. And the treatment works. You can you break an arm, you can treat that arm like in almost 100% of people the same way, and you'll get a pretty good result. But once you have chronic illness, it's how your body has compensated for the events, and those compensations are built on compensations, and they're about your own personal lifestyle and genetics and your life experience. They all lead to a different way of your immune system interacting with the bug, and a very different immune system, because
Now
that's
you
why.
Yeah, you're talking about a paradigm shift, and I think all of us who do chronic disease medicine know this. The acute illness is not the problem we're having, but now that long COVID is out there, and right, they're throwing billions of dollars at this to figure it out. What I did, in fact, I did this about a week ago because I'm writing up a new series of case studies for the literature. I looked up long COVID to see how many of the factors on the MSIDS map are now associated with long COVID. All 16. When I did an interview with Dale Bredesen, and I looked up Alzheimer's, and I said, well, how many of these factors are associated with Alzheimer's? It was all 16. And I have a feeling as I start going forward, looking at ME, chronic fatigue, what I think the problem is that we have not had like a way of understanding chronic illness of like there are multiple sources of inflammation. There are downstream effects, because if you just talk about mitochondrial dysfunction for fatigue, but you didn't look at the hormones and you didn't look at Pott's dysautonomia as a cause of fatigue, or that BART is hanging around, you're going to miss all the other causes of fatigue. So it's almost like we needed a new checklist and a way of understanding chronic illness. And I think that's what a lot of us in the field, I think, are discovering. I mean, have you discovered kind of the same thing over time?
Yeah, I mean, I say yes so blithely, because yes, this is the issue, is that chronic illness has a very common underpinnings, and what makes them different, it's all, toxins, viruses that you haven't dealt with completely, or your immune system keeps letting them pop up and stress your body, infections that are, that live with us, and that's, yeah. And stress, the craziness of modern life, and EMFs probably, I mean, all these things have made a new soup. Okay, because the old soup was infections, was acute infections, but now, with the addition of, what, 80,000 somewhat chemicals, God knows how many pieces of nanoplastic. I mean, like, we have a litany of stuff that can hurt us out there in the environment, and at the same time, the way our lifestyle has isolated us and kept us away from community. Okay, I mean, like, and that's why like, there's a lot. I think the isolation that has changed when we were growing up, when I was growing up in the 50s and 60s, almost everybody lived in neighborhoods. There are only a few, the super rich were like, isolated in their little conclave, in their little thing. But the rest of us, poor people, middle class people, upper middle class people, there were neighborhoods where kids were in the street all the time, you know? Um, and everybody interacted, and the families were bigger. But now, in the last 60, 70 years, as we've shrunk to this really like isolated nuclear family, we're all in our little fortresses. And that is not good for your immune system. Okay. We need exposure, not just to bugs, because the exposure to bugs makes us healthier in a way, but we need exposure to other people and other feeling states and other ideas. Okay, I won't go off into, it's just, we
No,
need
no,
to
but you're
share.
correct. In fact, I mean, what happened with this outbreak with COVID, when people were isolating, the reason they felt that, the flu epidemic and the RSV epidemic and metapneumonia virus and all these other things popping up, even mycoplasma, is because we were too isolated. People weren't, right? They weren't being exposed. They weren't getting cross-reactive. Their antibodies weren't keeping up. That's part of the reason we're seeing all these viruses now come back, because you're right. People did not get the same type of exposure the last couple of years.
Yeah. But but it's also the societal isolation, I think, is just I don't want to say killing, but is dampening that energy that we need to be human, and that human interaction is what helps people heal. And I think we really need to bring to, I don't know, I'm a man of lots of questions, lots of problems. Well, I have answers, I think, sometimes for individual patients, but for figuring out society, no, I don't.
I don't think anybody's figured that one out completely at this point,
Right.
considering
Yeah.
some of the things going
I'm
on.
working. I like to work one at a time. I know many people who are in public health and they're trying to save all of us, and God bless, I appreciate it. But we work one at a time, and looking for what is out of balance in your body that needs balancing and what we can balance. Because see, one of the biggest issues that I find in the really difficult to help patient, is you're always, it seems like every move you make, you're checkmated because that system has become so defensive.
Mhm.
Okay. So, they can't, even the compounded antihistamines, they can't tolerate, it's that kind of, even gentle touch can sometimes cause an extreme, response, and not just pulling away, but a crash. People can have their bodies pushed to such places that we really have to work very hard at finding the note that body can that body can hear to begin to heal, because some people start to collapse, and well, I don't, they get to the point where noise and light and all kinds of stimuli are just too much. And so they're
And by
the
the way, I mean, apart
extreme.
from the tick-borne doing it, you said it before, the chemical exposure, the worst people that I see in my practice, and these are probably a lot of the people that come to see you, are the ones who have chemical sensitivity, who are very, very chemically sensitive. They're mast cell, the ones that are immediately sensitive to light, to touch, to sound. I mean, those are usually the ones the mast cells are just hyperactivated, right? So those are the ones I think we're all seeing. But do you have anything, in your experience now, seeing all these people, in fact, that come to you and they failed a lot of other physicians, what is like the top 5 or 6 things you find that maybe was missed by other doctors? What do you find sometimes is the clue for a lot of these patients, regarding their pain, but also regarding just, in general, getting that mind, body, spirit back in balance?
Well, actually, I was going to say, mold and mast cells, but really the thing that's almost 100% is their structure. Okay. People do not look at the structure, because once, we all can have, abnormal, our one shoulder higher, our heads forward, our back is too straight or too curved. We can have lots of minor changes in our body and be fine, have no pain, and be running our lives and doing everything with no problem. But when you add chronic inflammation, all that changes. Okay. And then that head forward position, which has been straining your neck for the whole life, that old story, 5% flexion, like quadruples the weight of your brain, the weight of your head. So, for your neck muscles. So, but you look around you, everybody's walking around these days with their heads forward. And they're doing okay. But when that person gets inflamed, when inflammation stays chronic, then those the tiny areas where your nerves are coming out of the base of your skull, especially the vagus, which comes out of the base of the skull, and also even areas in the brainstem at the bottom of the brain, if those ligaments get a little lax, so hyper mobility is a big one, but you don't need the hypermobility. That just makes it a lot worse. But just having chronic muscle tension is going to decrease drainage from your brain. Okay, so how many people come in with the head pressure? My head, I got constant head pressure. Well, when your traps, the muscles that hold that the big shoulder things here, and we call the scalenes, the little guys that are like right behind your collarbone, and if you press in there and you go, oh, that's really not happy, that's not good. Okay, because that means you're not breathing well. Okay, because you're overworking these muscles, to breathe, and you're not draining. I think that's the biggest thing. We talk about, Dr. Parpia likes to use that word pretox. Well, a big part of pretox in my world is opening up the body, because in the sickest people, if we can begin to get a little opening of the connective tissue, the fascia, the things that people don't think about, it will help. And this usually requires a good osteopath, a good, anyone with good hands. I hate to always, it doesn't have to be an osteopath, but it has to be someone who's trained in usually in cranial, or there's now a multitude of different things out there that they kind of are offshoots of cranial and Feldenkrais work, which are very gentle, but begin to talk to the body, open up the connective tissue, and let things drain, because that's why you often have a lot of pain in that shoulder, because you maybe just twisted that thing, 20 years ago, and it didn't really bother you, but then you get, Lyme disease, and it's really a problem. Well, it's a problem because your body has 20 years ago, when you twisted that, it didn't really heal completely. And so there's restriction in that area. The muscles are a little tight. The nerves are not as happy. The lymph drainage is not as good. But again, we don't feel it. But once you get inflammation, that you get a little more fluid in that area, and then you really begin to impede the lymph drainage, because the lymph is such a low pressure system that millimeters of mercury, tiny amounts of pressure change is enough to impede it. And
Right.
that's
So,
so
So
that's
Eric,
the
you
biggest
bring up
thing
some
I
very
see.
important points, which is, and I think, and you're the first person, by the way, I've interviewed so far in the summit who's discussed this, is because these people come to you and they failed so many doctors. One of the things really you're saying regarding pain and just getting them better
Yeah.
is don't ignore structure and don't ignore drainage to make sure that the body is getting rid of these. But, of course, when you were mentioning the neck, Lyme, of course, it's known it goes into the collagen, and these people have, the Lyme shrug where they're, kind of doing this all day long because it's tight. I do find, of course, it does get better, but you're right. I mean, Neil, I know, loves cranial sacral. I mean, in these techniques, Feldenkrais, craniosacral. I mean, my brother-in-law is a chiropractor. I've certainly sent people, and he's gotten help with them
Yeah.
sometimes when they can't get help in other places. So you're right. I think it's something that's overlooked that people need to keep in mind. It's not just liver detox, getting phase 1, phase 2. It's really talking about how to get the whole body to drain, right? And using things like craniosacral to kind of relax some of these areas to get it back into balance.
Yeah. And one thing I really want to emphasize here is just be careful and be gentle. If you think of yourself as a very sensitive person who has trouble with lots of medicines and just has to keep the world a little bit far away from you, let the person know that you're that sensitive, and really suggest that maybe they only treat you for 10, 15 minutes the first time, and be gentle, because what happens is that if you begin to release this stuff, you will have a herx. You will feel terrible sometimes if you do it too quickly. And then you're going to say, oh my God, stay away from me. This is terrible. I never want to, you can't touch me.
It's
And
funny you bring that up. My wife early on, before she had done Dapsone, because she's now like 4.5, almost 5 years in remission, when
Right.
she used to go get massage, and this person would do some really deep tissue massages with her, she would be herxing the next day because she basically was like letting go a lot of these toxins and stuff from her body, and it took a couple of days to clear it. So yeah, no, I've seen that with my wife, and I've seen it with patients. You're right. You got to listen to how sensitive people are and kind of where their body's at.
Yeah. Yeah. No, and my biggest concern is because I have so many people who I have to, sometimes it takes me years to convince them to let the people, because I've got a bunch of people who work with me. I've collected them over the years because they're hard to find. The people who really understand the fascia, because so many people who have like chest pains and they think they have tachycardias, but with the pulse monitor doesn't, the pulse is 70, but they feel their heart. Well, your heart is enveloped in connective tissue, and that can twitch. Okay. And I mean, there's all kinds of wonderful connections in the body. I mean, like the tongue and the heart I mean, there's just amazing stuff out there that as a regular doctor, nobody told us anything about, and as people are getting more, I mean, not getting more. And if you really want to deal with the full body and let people really heal from the inside out, if you open these areas up, they'll drain. The nervous system will be more relaxed. They'll have more resilience. But it's slow work for a lot of them. And but it's yeah, I gotta say that's probably when people have been willing to do it. Because it's funny, people will come and be glad to pay me tons of money to talk to me. Okay. But when I want them to spend, a fair amount of money to have somebody touch them, they go, oh, I've had massages, doesn't do anything. I don't, and no matter how much you try to explain it, it's that mindset is like, there's nothing that anybody can do that's going to change my body. And I just sad
No,
because
and
I'm
and
so.
we hold emotions. The person who works on me at least once a month, she does myofascial release.
Mm.
And a couple of months ago, she had gotten in there deeper than I think anybody has gotten in a while. And I noticed I started crying. I started releasing stuff, and I realized it was an area of my body I had held trauma from childhood. And I was shocked. And I said to her, "Is this something you see from time to time?" And she said, "Oh yeah, like all the time." And I think people don't realize, because you started earlier talking about this mind-body connection, the body is holding on to these things. And sometimes you need very specialized techniques with drainage, right? Especially in these very sensitive people.
Yeah, and you make me realize I have to put something together because in you know interviewing lots of people over the last few years, I've begun to collect people who have such different techniques, and that's I think the other thing that's got to be so frustrating for a patient, because even if they have unlimited resources, nobody has unlimited time, and so and most of us have limited resources, so it's really hard to spend a fair amount of money on something that doesn't work, you know? And when it comes to this mind body work, as we always talked about earlier, we have to find ways um, to have a better idea of what's going to work for which person, because it's like now we have a million machines out there, the pulsed electron, the PMF, the pulsed electromagnetic fields, the microcurrents, and these are all great, but sometimes they make people worse because they detox too quickly. So again, knowing and some people's nervous systems like one more than the other. It's just uh, there's so much to learn, and unfortunately, we can't even fund, like studying something like dapsone, which is like, it's a thing we can measure it, and we can have I mean, we can really know who it works in if you had enough money, and so we're never, I mean, I don't know if we'll ever get to the point of really figuring out who all these other small things work for. They're all so subtle because there are so many different ways of talking to the body and dancing with the body. And dreams, I have dreams of being able to parse those out someday so we could just be more efficient in helping people get well. Because right now, I know that we're wrong about what's going to be the best treatment for you in the beginning. We have to make a few mistakes. We say we're playing pin the tail on the donkey. That's always like, and the patient unfortunately is the donkey. And it would be nice if we could take the blindfolds off and we had the information to know what therapy for what person, because that's the bottom line. These chronic illnesses are are about your body, and just like some of us are tall, some of us are short, some of us look better in with this and that, we're all different, and that's not something that medicine wants to hear. Medicine wants the Kaiser approach to medicine, which
No,
is
I think, the personalized precision medicine approach, using obviously the omics approach in the future, but also a clinician taking the time to listen, right? To listen to the patient, to feel into the patient, to see what's needed. No matter how good the AI gets, there's a point where it's ultimately going to be the clinician who listens carefully. And that's something you've been doing, obviously, for a very long
yeah.
time, that gets people better. So, believe it or not, we have come
Oh,
to about an hour of our talk. We're coming to the end of it. So I just wanted to thank you again, Eric, for taking the time today to discuss, how you're getting these chronically ill patients with pain better, who come to you with chronic Lyme and co-infections. It's been fascinating actually hearing, the way you do this. Can you just tell people one last time, if they want to get in touch with you, the best way of getting in touch with you, and do you have any upcoming seminars or webinars or anything you want to tell people about?
oh yes. Well, getting in touch with us, gordonmedical.com. There's a a button there that says, and somebody, you can make a call. Somebody will give you a call back. They can schedule an introduction call, so you'll know how we work and what we think we can do. And yes, and we do have a summit coming, a symposium coming up called Cracking the Chronic Code: Ticks, Toxins, and Mold. I think I have the title right, but that's it. It's Dr. Parpia and I, and we interview a bunch of really interesting people, including the good Dr. Horowitz, where we get a little deeper dive into Dapsone for those of you who are going to need more information. There's more there.
Well, thank you, Eric.
So
This
thank
was
you.
great.
Yeah,
So
thank
thank
you,
you.
Richard.
Yeah, thank you for taking the time today, and good luck. I mean, you've been in the field for a long time in the in the trenches, helping these chronically ill people, trying to figure it out. So bravo, because as you said, the acute medicine phase everybody's pretty much got, but these chronically ill patients that go from doctor to doctor who are looking for answers, you're one of those people they end up coming to when they fail, and I know people who've gotten help. So thank you so much for taking the time. And again, for everyone who's been listening, you've been listening to the Healing from Lyme Summit. I'm your co-host, Dr. Richard Horowitz. Thank you for joining us today, and I look forward to speaking to you again at another summit. Thank you so much.